Welcome to TrialSite News Podcast Series. We're excited to have the founders of Attune Functional Medicine Clinic, Dr. Ashley Biscoe and Dr. Alison Egeland, here with us today. The clinic is all about a comprehensive naturopathic medicine approach with science-based natural therapies to help people heal and stay well. And today we will be discussing everything Hidradenitis Suppurativa, including various stages, skincare, pain management, and more. So Dr. Ashley and Dr. Alison, welcome.
Thank you.
Well, it's our pleasure to have you guys. Now, before we deep dive into the nitty-gritty of Hidradenitis Suppurativa, I'm going to ask you each a question and just kind of get our audience to get to know you guys. And so we're going to start with you, Dr. Ashley. And if you would, tell us about your own personal struggles with undiagnosed medical issues and how it related to working in the industry and in the capacity that you do today.
Yeah, absolutely. I'd be glad to. So, I was generally a healthy kid, but one thing that did happen to me is I developed acne at a pretty young age. Believe it or not, I was around 10 or 11, which, is a very early onset for acne. And it was moderate. I managed it with over-the-counters, things like benzoyl peroxide and various creams and whatnot. And as I went into my later teen years and then went off to college, I decided that I wanted my skin totally clear. So my mom, with the best of intentions, took me to a dermatologist, and this dermatologist prescribed a 3-month course of doxycycline antibiotic along with a 1-month course of a steroid. And within a month or so, my skin was flawless, and I was over the moon happy, and I was like, this is great. But then something shifted and the acne started coming back, and it came back worse than it had ever been. So it went from mild to moderate to being cystic, deep. I was waking up with blood spots on my pillow sometimes. I recall wearing turtlenecks in the summertime because I had cystic lesions on my neck and chest and shoulders. And I also developed headaches, and I was tired all the time, and I was constipated all the time, and my digestion was all over the place, and I just didn't feel well. And every time I would go to the health clinic, I was in college at the time, so every time I would go to the health clinic for a workup, they would run the most basic of labs and say, well, you're in school, you're just stressed. And I thought, but I've always been a high achiever. I was busy in high school. I, was in honor society, and I worked a job, and this didn't happen then, and it just didn't make sense. So finally, I went around in circles for years, Adrian. I was desperate to get back to who I wanted to be. I was frustrated that I couldn't wear the things I wanted to wear. I wasn't dating. By this time I was in my early 20s. I didn't have the confidence to date because of the way my face looked. And so I started going online. And by this time I was in my public health grad program, so I was already kind of a research nerd. And I started reading everything from the medical research to health forums online. And finally, I had gathered enough information to really connect the dots, and I realized those antibiotics destroyed my gut flora, and I have severe intestinal dysbiosis, imbalance in the microbes in my gut, and lots of yeast overgrowth. And so at the time, I didn't know that a naturopathic doctor existed, and I didn't have a lot of resources. And so I self-treated. I drastically changed my diet because I was a sugar junkie back then. I really paid attention to my sleep because I was a night owl back then. And I self-selected some herbs. I don't necessarily recommend that people do that now, but back then I was like, well, I've got nothing to lose. So I took some herbal antifungals and got really strict about my lifestyle and diet. And I healed, and I became like a new person. And in the quest for answers, I learned how much misinformation was out there. And frankly, it pissed me off. I was really angry that all of this ability to heal naturally in a safe way and the risks of some of these conventional therapies that people aren't warned about, I was just really angry. And I felt compelled to share with other people what I had learned for myself. And I did some Google searching, and I stumbled upon the website of the American Association of Naturopathic Physicians and felt like I'd hit the jackpot. I was like, oh my God, this is a real profession. So I went back to school for naturopathic school, and that's what inspired me today. And, when I learned about HS while I was in naturopathic school, I was also really upset at the limited treatment options available. I couldn't believe that such a debilitating condition wasn't getting more awareness. And because I had suffered from such a painful skin condition, that's what you show to the world. And I think it just really hit my heartstrings in the right place. And I made it a point at that time. I'm like, I'm going to understand this condition, and when I practice, I'm going to focus on this because it's too important. And I know how it feels to have a chronic skin condition. Not comparing my acne to HS, so I don't want to offend anyone, but just that I can relate to having, when it's your skin, it's hard to hide. And if you're having a stomach ache, you can get through the day maybe, and people don't know, but it really struck my heart in the right way. So that's what led me here.
Gotcha. Well, thank you for sharing. And then Dr. Alison Egeland, if you would, I know that you also battled your own chronic pain and eczema. Tell us about that.
Yeah, so mine's a little different, but I also had some skin stuff. I really think a lot of my health stuff started as a kid. I just remember having stomach aches a lot, and looking back, I think a lot of it was from stress, but my diet wasn't great. Like most kids, I loved sugar, cereal, processed
Who doesn't?
Yeah, but I also, I was also treated with antibiotics at a really young age for pneumonia, and I do wonder how that might have affected, my gut health long term. Flash forward to teenage years, early 20s, again, diet wasn't great. I was under a lot of stress, not taking care of myself. And in addition to stomach pain, I had anxiety, depression. And then when I started working after college, I was just so stressed out. And that's when I feel like I really hit a breaking point. I had eczema on my face. And again, that's how you interact with others in the world. And so having eczema all over your face is painful emotionally and physically. And then I also had acne rosacea on top of it. And so, again, antibiotic therapy, steroids would kind of palliate it for a short period of time, and then it would come back worse. And so I struggled with that for quite a while. And again, through all of this, I still had the chronic stomach pain, the anxiety, the depression, and I also have a family history of stomach cancer. So one of my aunts actually referred me to a doctor that practiced more holistically, and I started seeing her. And I also had a yeast overgrowth problem. I probably had some other gut infections and had to clean up my diet. I figured out that gluten is a real problem for me. I have the genes for celiac disease, and long story short, cleaned up my diet, took care of the chemicals in my environment, started lifestyle, sleeping better. And over the course of a year or two, my health completely turned around, and it just made so much sense to me that medicine was practiced in that way, because the other medications, it seemed like they'd help for a little bit and then they'd get worse again. So I joke that I became obsessed with health. And again, like Ashley, I found out that about the naturopathic profession. I was so excited. And I also went back to school, and I had luckily already taken pre-med courses because I was always interested in medicine and healthcare. So
gotcha. And then, so what then was the driving force to start your own clinic together?
Well, Ashley and I went to school together.
Yeah.
That's a good start.
We were always good friends in school, and not to sound cheesy, but Alison to me always stood out above the rest. She was always I could tell that she cared. She was so excited about the science and how it could help people, and she was always so kind and professional. So I've always really respected her. And we just decided that after graduation, we were going to keep in touch. And Alison's husband wanted to move out west. And on the spur of the moment, he just said, "Hey, what if you guys started a clinic together?" And we were like, "Let's do it." So my husband got a job, and we just packed out and moved.
Well, I'm glad you guys got to meet in college, and especially those early friendships in life. Those tend to be the ones that stay.
Yeah.
So now let's shift to our topic of today, and which is hidradenitis suppurativa. So first, and probably one of the more important questions, is how important is gut health in connection with hidradenitis suppurativa and other autoimmune or autoinflammatory diseases?
Gut health is just so extremely important. The majority of our immune system is actually within our gut. We have something called GALT. It's gut-associated lymphoid tissue. And that lymph, it really, is just really important for the immune function. But, all autoimmune conditions have this compromise of the gut barrier. It gets called leaky gut a lot. But what happens with that is when that gut barrier is compromised, we get food proteins, bacterial proteins. We get a lot of stuff into the rest of the body. It literally leaks through, and it shouldn't be there. And then the immune system, it has to be really smart. It has to know, what's a virus, what's a bacteria, what's food, essentially what's safe and what's dangerous. And when it's getting all of these things leaking through that shouldn't be there, that really stirs up the immune response. And then that can turn into inflammation and, goes back to genetics, each person's genetic susceptibility or weak point in how that inflammation expresses. And very specifically with a lot of autoimmune conditions and then HS, we also see a huge problem with fungal or yeast overgrowth as well. And a lot of our patients actually have a significant history of antibiotic use. Those antibiotics kill off the good bacteria along with the bad, and then that creates the perfect environment for yeast to really thrive and overgrow. And we do know that yeast specifically drives an inflammatory Th17 response, and that's linked with a number of autoimmune conditions, but also specifically with HS. I'm sure, Ashley, you have more to say about it.
Yeah. Well, another thing I'm always harping on with my patients is the notion of LPS. And LPS stands for lipopolysaccharide, and it's a sugar-like molecule on the outer surface of gram-negative bacteria. And one of the things that can happen if your gut is imbalanced and you've got a lot of gram-negative bugs in there, those bacteria can translocate through the gut wall and get into the systemic circulation, and your immune system just kind of freaks out. This LPS toxin is one of the most irritating substances known to man, and there's a lot of research about how it's implicated in everything from chronic pelvic pain to endometriosis to allergies. It's just our immune system is really primed to recognize it because it's linked with bacteria. And actually there was, we're such research nerds, there was a recent study that just got published about HS, and they found that people with HS had higher levels of bacterial antigens in their blood, and that happened via translocation. So again, it's the moving of this bacterial antigen, and it can cross through a compromised gut barrier and get into the blood. So compared to the controls, the people with HS in this study had way more bacterial antigens circulating through their blood, and that implies that that gateway, that barrier has been breached. So gut health is just really important. The other thing I will say too, so HS is strongly linked with histamine, and histamine has been found in higher concentrations within the skin lesions of HS and also in the surrounding skin. And one of the ways that the body copes with histamine is by making an enzyme called DAO, or diamine oxidase, and it's produced by healthy intestinal cells. So when your gut is healthy, you should be able to produce a lot of this enzyme that will break down the histamine. But if the gut barrier is compromised, you're not able to keep that histamine in check. And again, histamine plays a role in the inflammatory process of HS. So it's huge. There's so much more research coming out about what we call the gut-skin axis, and how there's this bidirectional link where whatever's happening in the gut is going to manifest in the skin. So even thinking about my own story, my face reflected what was happening in my gut. The acne got bad when the yeast got bad.
Now, for HS, we do normally hear that there are about 3 stages of it. Do you think there are 3 stages or more?
Yeah, I love this question. And I don't know that there's a perfect answer, but here's what I can tell you. So at this point, the 3 Hurley stages are, the accepted way of sort of grading the severity or the clinical presentation of HS. The reason we need some sort of classification or grading system is because when they are doing things like clinical trials, you have to be able to clearly define either what stage a therapy is effective for, or what was the improvement. So it really helps in keeping things clear from a research perspective.
Mm-hmm.
But I think it's fluid. And the problem with the early stages is that it really doesn't take into account quality of life issues. And actually in the medical research, they're kind of challenging the 3 stages and coming up with different proposed ways of categorizing HS, which is hard because it is a very heterogeneous condition. But for example, Hurley doesn't take into account quality of life. So someone in Hurley stage 1 could have excruciating pain, but someone in stage 2 might have minimal pain. So how do you define what's severe or not, right? Like, are you basing it on the pain or the number of lesions? Hurley also doesn't take into account the inflammatory component or how many sites are involved. Classically, Hurley is really based on the number of lesions and whether there's tunneling, whether there's significant scarring, whether a diffuse area or like a whole area is involved. But it presents in many ways. So the Hurley stages, it's fast and easy, but it's not really ideal for monitoring the efficacy. So one thing that has been proposed that we've learned about is called the modified Sartorius score. It's a little more detailed. That one is based on counting individual nodules and fistulas within different anatomical regions. So you have to measure the longest distance between 2 lesions of the same type within each anatomical region. So if you have, let's say, a couple of skin bumps under the underarm, you would have to measure the longest distance between those 2 lesions within that same underarm. It's very time consuming, and you can imagine that it's probably hard to interpret. There was also another one called the HS Physician's Global Assessment. That one's a little bit easier to use, and it's based on measuring the clinical improvement for clinical trials. I like this one because it does classify the severity by counting the number of abscesses, the number of fistulas, and the inflammatory and non-inflammatory nodules in all of the areas. So they have like this staging system that ranges from 1 to 6. 1 is clear or no inflammatory nodules. 6 is severe, meaning more than 5 abscesses. So for the sake of not boring you guys, but, there's a lot of different ways. And I don't think the scientific community has truly decided on where the future direction will be. But for now, I think Hurley is an easily understandable way. And honestly, when we work with our own patients, I'm thinking in terms of Hurley. It's easy for us to take a look and say, this is stage 1, this is clearly stage 3, just for clinical reference. So,
right. Well, and as you mentioned, it is fluid. Now, for those that are suffering from HS, is there a daily skincare routine that you would suggest that they follow?
Yeah, so, the important thing is to keep the skin clean, but you don't want to be overly clean, especially with harsh scrubbing. And the reason for that, and I know that, hygiene or the perception of hygiene is a concern for a lot of people. I have heard heartbreaking stories of people being called into HR because of, odor, or even just feeling self-conscious if you aren't sure if your odor is, perceptible to others. But this is not a dirty condition. And we advise against friction because friction is a very important variable that can trigger folliculitis. Folliculitis is basically inflammation of the hair follicle. And that folliculitis is the initial inflammation that can trigger the formation of a new lesion. So I recommend gentle washing with a mild cleanser. I think in some cases, and we've talked about this in some of our videos, chemical-based peeling agents can be supportive. And I know that there are some over-the-counter like salicylic acid washes, etc. Those might be helpful. I have not yet recommended them, normally because I have yet to find one that's readily available that doesn't have a lot of chemical additives and perfumes, and I think that's not going to be good either. But you don't want to do a lot of friction and scrubbing, so gentle washing, hands only. You don't need to use a washcloth or a rag. I also recommend loose ventilated clothing because, again, any friction, so even like the seam of underwear as it hits your inner thigh crease, that can be a point of contact for friction and triggering a new lesion to form. Nothing overly tight, no, if you can use more natural fabrics that are breathable, that can be helpful. And for women listening, natural tampons can be a better option than pads. And I've had several of my female patients with HS notice that if they're using like a pad or like a sanitary napkin, that can be another friction point. So anything that macerates the skin, anything that is overly friction, causing too much friction, that can be a problem. We don't recommend anything with fragrance or perfume. And some people have reported that they get good results with like antibacterial soaps and washes. The problem we see with this is that a lot of these soaps are breeding bacterial resistance, and we have a microflora on our skin too. So, we don't want to support the growth of unhealthy bacteria or even yeasts on the skin. But also a lot of the synthetic antibacterial agents that they use are really bad hormone disruptors. And we know that hormone imbalance is another factor in HS. Now, if someone is able to be physically active and if they're kind of sweating, we do recommend washing with a gentle soap post-workout to remove the sweat, because anything, like the salts and sweat, or even if you have shed some skin cells, that can also clog the hair follicle.
Oh, wow.
And again, we don't want to trigger any clogging, because that's kind of the first step, along with inflammation that can lead to a new lesion.
Gotcha. And what would you then advise for HS patients for pain management?
Yeah, so I would say pain is really one of the most important things we need to address. Honestly, the Manuka ply, it's a medical grade honey. We have found that helps the most. It just really helps to decrease inflammation. It supports the microbial balance. It supports healing. It contains something called methylglyoxal. It's abbreviated MGO. It's almost like a type of peroxide, but it's much more gentle, and it really just promotes the healing process. And a lot of our patients report a significant decrease in pain with that. Now, that said, there's a lot of other things we do as well. And so anytime we're looking at a patient or working with a patient with HS, we're going to address as many of the underlying drivers of inflammation as possible, because we know that inflammation is what drives that pain. So we're always going to be addressing things like the diet. We really want to support removing inflammatory foods from the diet. We want to support hormone balance. Things like insulin resistance can interfere with our hormones and be another driver of inflammation. There's some really wonderful anti-inflammatory herbs. Curcumin is one that we use a lot, and that actually blocks a really potent inflammatory molecule in the body called TNF-alpha. And so there's a lot of different things we look at and support. There's actually another formula too called Pain Block R by Life Seasons. That's one we've recently discovered that has also worked really well. And then CBD oil, we use a hemp-derived CBD oil that's very anti-inflammatory. It also supports decreasing anxiety, because a lot of patients, when they're in pain, they're suffering, they have a lot of anxiety that goes along with that as well. So really, it's kind of a long-winded answer to a really important question, but we're supporting them in as many ways as possible to decrease inflammation, decrease pain. And it's really, we're looking at the individual and supporting each person based on their own factors as well. So I don't know if you have anything else.
Yeah, I think the one thing I'll add is we always try to be so compassionate in we need options, right? If someone's in pain, and sometimes you just have to get through your day. So I'm speaking to the over-the-counter NSAIDs, things like ibuprofen. And, those can be okay on rare occasions, but we don't want people to get into the habit of taking those on a regular basis, simply because they do disrupt that healthy gut barrier. So in the short term, they can be supportive for pain relief, and sometimes that's very appropriate. But in the long run, we want to start shifting towards things that are not going to do harm in the process of palliating. So when we think about, as naturopathic doctors, first do no harm, we are prioritizing therapies that will give us the results we want without hopefully imparting first and second and third order consequences down the road.
Right.
In the short term, you can take an antibiotic and clear up your acne, but in the long run, it might come back worse, and now your gut's imbalanced and you're at risk for autoimmune disease. So really carefully weighing those risks and benefits.
Definitely. Now, on that same vein of long-term damage, HS patients often hear that weight and smoking are triggers for HS. Now, have you found this to be accurate?
It's interesting. Most of our patients have not been smokers. We are aware of the mechanism of smoking and how that contributes to HS. For example, nicotine actually thickens the outer layer of the skin, and then that can lead to plugging of the hair follicle. That's the initiating event with HS and those lesions. Nicotine actually also promotes staph bacteria that can also drive more inflammation and problems. It can affect the hair follicle, and it's one more mechanism for how nicotine is linked with HS. And then, of course, smoking. It's really, it drives inflammation throughout the body. It decreases our ability to oxygenate our tissues, and that is so important for healing and repairing. If anyone's ever had to have surgery, there's a lot of doctors who will not do surgery if you're smoking because they know you're not going to heal, you're not going to get a good outcome. And so the top thing we can recommend, of course, if you are smoking, is to definitely quit. But fortunately, most of our patients have not been smokers. And then, of course, being overweight, a lot of people, I think there's a lot of shame and blame around this. Being obese does not cause HS. There are some really important connections, though. We do know that insulin resistance is linked with being overweight. It's also a really important driver of inflammation that has been associated with the condition. A lot of foods that cause weight gain increase blood sugar, they increase insulin. So there's multiple mechanisms and links with that. Insulin also actually makes hair follicles very sensitive to androgen hormones like testosterone. And that again can lead to that follicular plugging and the inflammation that we see. And I know Ashley has more thoughts.
Yeah, when I think about the weight and HS connection, everything that Dr. Allison just mentioned, but I also really see that the same types of foods that promote weight gain, the sugar, the refined carbs, the inflammatory vegetable oils, those are also the same foods that drive inflammation. So there's a strong association there. Also, a larger person, just going back to the mechanical thought here, so, a larger person may have more skin folds, and that creates a warm, moist environment that can breed bacteria and yeast. And then there's also going to be more friction in parts where skin rubs together. So these are known common triggers that do make HS worse. And if you look across the medical research, it's pretty clear there's an association that overweight people do tend to have more severe disease. And I think that's likely because of all the factors that we just discussed, diet, friction, etc. But the other thing that's so important to know is that fat cells are not just these inanimate blobs, right? Fat tissue is an active endocrine organ. These are living cells that produce hormones, and they produce inflammatory molecules. So when we think about getting inflammation under control in the body, your fat cells are making inflammatory proteins. Fat is also a storage house for environmental toxins. The body is very smart. It wants to protect your vital organs, so it will store toxins and chemicals away in your fat cells. And then going the opposite way, these chemicals can actually cause obesity. In public health, we call them obesogens. They are literally generating obesity, and that's for many reasons. They can hijack your hormones. They can mimic our hormones, disrupt our receptors. There's a lot of different physiological mechanisms for that. And so while, a lot of people beat themselves up about diet and exercise, but we just want to stress that while these things are important, there's a lot more to the story. And we've worked with several patients who are, doing everything right, so to speak, and they're still struggling. And this is when you really have to look at other factors like toxic exposures, infections, other things that drive inflammation and hormone imbalance. In terms of our own experience, our patients have been all different sizes. Some of our patients are obese. Some of them are lean athletes. Some have been, women in their 20s or 30s with maybe 10 to 15 extra pounds. But at the end of the day, what we have found matters the most is the total sum of all of the variables that impact their health. For example, we've worked with HS patients that were overweight when they started working with us, and then with diet and lifestyle changes, they were able to achieve a healthy weight, and their HS dramatically improved, but there was still more work to do before getting their HS completely cleared.
Now, for HS patients that are going to see or getting their first appointment rather with a doctor, what are some basic questions you would advise them to ask? And in that same vein, are there things you recommend they bring with them as well?
Yeah, so I think it's really important to ask about the success rates of the therapies being offered. You always want to know about short-term and long-term risks. Most of our HS patients have been on multiple rounds of antibiotics. That tends to be first-line therapy. And we've just seen over time that really can make the condition worse. Again, it really disrupts that microbiome. It leads to the yeast overgrowth. And so there's that. We definitely acknowledge that there is a time for antibiotic therapy, but it's also important to know about those risks and benefits. And of course, there's a time and a place for surgery as well, but it's not always guaranteed. I've seen patients where they'll have surgery to correct the underarm area, and then they start getting new lesions in the groin area. So the inflammation in the body is going to go somewhere. And so again, that's why we really are always looking at figuring out all of the potential causes and factors and addressing those as much as possible. I always think it's important to let your doctor know about any supplements or medications that you're taking. I think it can be really helpful to type up a little medical history, including a timeline. That can be extremely helpful, especially when the doctor is really short on time. Sure, Ashley, I'm sure you have more thoughts.
Oh, yeah. Well, we allow a lot of time in our clinic to ask questions about the person's history. Yeah. And sadly, a lot of our patients who have come to us after first going through a lot of traditional providers, they just don't feel heard. And I want to stress, it's not that provider's fault. Our healthcare system, the traditional healthcare system, is not set up for these in-depth appointments where you can really delve into the intricacies of, what are you eating and how's your sleep quality and your emotions. But we always find it helpful when patients bring in any previous medical records or lab records that they have. We also like to know about their complete health history, including, how was your early childhood health? Were you born vaginally or through cesarean? That can affect the course of your microbiome throughout your life. Were you breastfed? So these are all helpful things to to share with your doctor, especially. I would say that we see more immune challenges and inflammatory conditions when the microbiome is out of balance, and that strongly correlates to early childhood use of antibiotics, especially if that person was not breastfed. It kind of sets you up for this early immune compromise, and I do think that leaves you more vulnerable to all of the environmental triggers that can throw your immune system out of balance even more.
Wow. Now, on that same vein, obviously we hear about several possible reasons HS gets suddenly activated in people. What do you think may be the cause or the initial trigger to activating HS?
Yeah, it's so multifactorial, but for us, the big ones are a genetic predisposition, and then on top of that, you can throw stress, infections, toxic exposures, underlying metabolic disturbances. Those can all be strong triggers, and everyone is different, but it's usually the perfect storm. So you've got someone who's genetically predisposed, and then something happens that sets off this initial cascade of events. There was actually a recent article in a naturopathic journal that we read, and it was a case of a woman who had her first flare at age 55, and that's pretty late onset.
Oh, wow.
Yeah, she did have a history of obesity and multiple antibiotics, and she also had a lot of environmental and drug allergies they detected. And interestingly, she had just recently had surgery to treat colorectal cancer. And again, there is some evidence showing that irradiation, especially if it affects the skin, can trigger an inflammatory cascade that can be a trigger for HS. I have also had patients who never had HS until they gave birth. I've had patients who never had HS until they went on a specific birth control pill, depending on the ratio or the types of hormones in that pill. And that also is documented in the research. But usually it's the perfect storm, and it's this the total sum of all of the irritating factors that can affect your system.
Yeah, so I think one concept we talk about with all of our patients to really kind of give them a visual is the idea that we all have a stress bucket, and in that bucket goes anything that stresses our system. So of course, mental, emotional stress, but then of course we have toxins in the environment, in the air, there's potential for heavy metals, mold toxins, infections, history of medications. And if you think about it, we're quite resilient. We can take quite a bit, but if that bucket fills up, gets full, and then starts to spill over, that's when we start to notice symptoms. So I think for many of these patients, when they all of a sudden have a seemingly sudden onset, really what happened is their bucket had been quite full, and then something like birth control pills just pushed them over the edge. That was literally the straw that broke the camel's back, so to speak. And that's when you really start to notice symptoms. So again, I don't think it's any one specific trigger. I think it's this concept of the stress bucket being full, or the total load of multiple factors all together at once just being more than the body can handle.
Right, reaching that breaking point, and then your body just freaks out.
Yeah, exactly.
Now, on that same vein then, we know that hidradenitis suppurativa patients usually aren't diagnosed right away, and sometimes it can take years to get the right diagnosis. Do you think that plays into the progression into stage 3 or higher?
I think I'm going to say yes. I have no proof of that, but what I can tell you is that inflammation is like a fire that builds on itself. This is the analogy I use all the time. And once your immune system is in this firestorm, it can build on itself. So the longer someone is going in circles, either not being treated or being mistreated because they've been misdiagnosed or undiagnosed, we do believe that gives a greater chance of not being able to get the inflammation under control. And the thing about HS is that it can be very progressive. So as the hair follicle ruptures, beneath, you won't see this on the surface, but this is how you get the tunneling as that ruptures, and then it can spread to the next, pilosebaceous unit. The next hair follicle is affected. It's kind of this vicious cycle. And so the earlier you can intervene, the better. But with that being said, some people never progress past stage 1, and some people never have multiple locations affected. And I think that's one of the puzzling things about really treating HS. When you really dive into the research, you see so many different presentations and the way it can manifest. And there are some great studies about what we call phenotypes. So trying to create clear understandings of how this condition might present and creating categories, because there might be different underlying physiological, biochemical, or even genetic influences that can affect how it presents in a person.
And on top of all of that, and we covered this a little bit earlier, which not just from the actual symptoms themselves, but with depression. So we hear that depression and anxiety often link up with this disease due to its pain and appearance. So how do you ladies go about helping patients with this part of the disease?
So I think obviously that's such an important thing to address. And I think there's multiple mechanisms for the depression and anxiety. There's a very strong gut-brain connection. And so we're always working to reestablish a healthy gut. So that's one level to help. Decreasing inflammation. We do know there's a lot of inflammation involved with both depression and anxiety. So we're going to work on those underlying drivers. But we're also going to talk about their support system. Do they have people surrounding them to help build them up, help just take care of them, keep them positive? We do refer for counseling. It's really, our recommendations are always going to be based on that individual. But I think it's important to understand there's multiple mechanisms for the depression and anxiety. Of course, being in pain and being embarrassed about your condition, those are major drivers. But again, the inflammation, the gut imbalance, we work on all aspects as much as possible.
Yeah. In addition to, referring to counseling when appropriate, or sometimes just letting people cry in my office, sometimes that can be cathartic. CBD oil, again, has been really helpful for anxiety for a lot of our patients, and we're able to use that in our clinic here. But also, I think just on a broader aspect, I would say hope. In my opinion, a lot of the depression comes when you feel hopeless and like this is your life, nothing's going to change. And so that's why we are so excited and passionate to get our message out there and let people know that we can dig deeper. There are things people can do on their own, because hopelessness, in my opinion, is, the nail in the coffin. It's like, hey, if there's no hope, if there's nothing I can do, then why would I ever try anything? And this is going to be my life. And I just think it's so important to let our patients know, or for anyone listening, that there's hope. I'm a big fan of Marie Forleo. If anyone's not familiar with her, she's kind of this business and marketing person that has a really positive message, but her whole message is everything is figure-outable. So that's always the attitude. That's the attitude that we take in our work. It's like, maybe all the answers aren't there yet, but everything is figure-outable, and you have to keep that hope alive.
Love that.
Gotcha. And then switching a little bit here to specific side effects and how to deal with it for those that are listening. One would be for those that suffer from itching of the wounds. Do you have any suggestions for people like that?
Yeah, so that's actually quite common. It doesn't get talked about as much as the pain, of course, with HS. Ashley touched on it earlier. The immune cells called mast cells release histamine. That is one of the major processes for the itching.
Right.
We find an elevation of an immune protein called IgE, immunoglobulin E. So working on that level can be really helpful. There's, of course, over-the-counter antihistamines like Zyrtec. There's supplements that are mast cell stabilizers. I know we've had some good results with things like All Clear. It goes back to a good healthy gut and making those DAO enzymes for breaking down histamine. So there are supplements, specifically some with DAO, again, to help break down histamine. We also do food testing to look at IgE immune reactions, because avoiding foods that are also raising IgE can be helpful for minimizing that. And then I know sitz baths can be really great. And
sometimes hydrotherapy can be really soothing, and that truly just means using water. So I tell my patients, use whatever temperature feels best for you, whether it's, very warm or cold. And that can be a compress, just, holding a washcloth over the area with the temperature that feels best for you, or what we call a sitz bath, which is just filling the tub with a little bit of water. Of course, this would be most appropriate if you have lesions in the groin area, but sometimes just the water, either warm or cold, can be be very soothing. And then I also do like the Derma E, the Skin Biotics cream that we've referenced in some of our videos. I like that one because the tea tree oil and the oregano can have kind of a cooling effect, and that can be really soothing, and it can help to, the soothing sensation kind of distracts from the itching sensation. It has an effect on those nerve endings. But
Right.
I really appreciate what Alison said too. At the end of the day, itching is histamine, and it's a part of that inflammatory process. So we do like to look for things like food allergy triggers that are going to automatically raise IgE levels in the body, which is a part of that histamine picture. Vitamin C and quercetin, those can help to stabilize the mast cells so that they're not so trigger happy to release those histamine granules. So those can be helpful as well.
Got you. And then for those, and I've seen this personally, for those that are finding it difficult to exercise due to either the pain or the sweat, which then causes them to flare, or fatigue, what advice would you have for them?
We honestly just recommend them to do any type of movement that they can tolerate. And sometimes it's literally just gentle stretching. And we've had patients that are in so much pain, walking isn't even possible for them. So any type of movement they can do. It's so important for moving the lymph around the body, and the lymph system is a major part of the way our body detoxes. And I do think there's a huge connection with lymph stagnation in the HS as well.
Yeah, I think swimming can also be a great option because it's gentle movement. You're probably not going to be sweating very much in the pool unless it's excessively hot, either outside or in the water. But honestly, you also have to listen to your body. And sometimes you have to do things other than too much movement to get to a place where you can move. So it's okay to focus on nutrition and sleep and stress. And sometimes the fatigue can be anemia. So I just want to touch on this for a little bit. If you are feeling tired, number one, it's important to get your thyroid checked because there is a connection with thyroid disease and HS. But number two, anemia is very common in HS. And that's because when the body is inflamed, there's multiple mechanisms by which the body has less iron. So you're not absorbing as much. It also affects the production of red blood cells. And then, of course, if you're having a lot of bloody discharge from the skin wounds, that's a chronic blood loss. So it's important to figure out why you're tired, and it can make more sense to correct those things first before trying to exert a lot of energy with exercise. Because the ability to exercise and having that energy is kind of a byproduct of being healthy in the first place. It's tricky though, because when you move your body, you do generate more mitochondria, and those are the energy making parts of our cells. But I just think it has to be at the right time because you don't want to push yourself too hard. Gentle movement, stretching, moving the lymph is important. Lymph only moves when you move. So even if you can just bend your knees or wave your arm, at your elbows a little bit, any movement is better.
Now, they are reporting that autoimmune diseases and hidradenitis, or HS specifically, are on the rise. Why do you think that is?
I think the biggest factor is the environment. It's changed rapidly. We're using new chemicals, herbicides, pesticides, insecticides. We're genetically modifying our food. There's a lot of things thrown at our immune system that it's never encountered in history. So I think that's the short answer. I'm sure Ashley has a more detailed answer.
Yeah, Alison took the words out of my mouth. I think the environmental component is huge. And there are tons of chemicals dumped into our water supply every day. Our air quality globally is not good. Our soil quality has gone down. So the foods that we eat are not necessarily giving us all of the optimal levels of nutrition that we need for healthy cellular function and detoxification and normal immune cell signaling. So the longer we do this work, and even as we talk to our naturopathic colleagues who've been practicing for decades, you keep hearing, the things we used to do aren't working anymore. It used to be enough to just diet and exercise, and it's so much deeper than that now. I also wonder about the mental emotional aspect, and I don't want to go too far down a rabbit hole, but I think we're exposed to a lot of social media, and that's been, that has been shown to cause changes in the body, brain changes. Every body system is connected. So if you are feeling depressed because of social media use, or you're staying up late playing video games or whatever, I just think our modern world is different than what our old genes have evolved with. But largely, I think that's the big one.
Yeah, that's actually, that's a good point. And now for those that are dealing with HS, are there any particular diets that they should follow, or is it more about removing specific types of food and so much compared to that diet?
That's a really important question, and I think there's some overarching themes, but when it comes down to the details, each person has slightly different triggers, but in general, we have found that HS patients do best when they avoid yeast. And that's actually something we talk a lot about on our Help for HS site, because it can be tricky. There's a lot of foods that contain yeast that you would never imagine. There was actually a really interesting study done, and they found that the patients, first of all, a lot of them were making antibodies or immune cells against yeast, and they all responded positively when they removed yeasty foods from their diet. So that is the top trigger that we see. Above and beyond that, we're always looking to promote an anti-inflammatory, nutrient-dense diet. So that means cutting out the sugar, the refined grains. Some people are sensitive to the nightshade family. That's your white potatoes, your tomatoes, your peppers. They contain alcohol compounds that tend to drive inflammation for some people. So there's a lot of different things to look at. In general, a really good starting place when someone is feeling really bad is to do the autoimmune paleo diet and avoid yeast, to just knock down inflammation as quickly as possible. And then from there, we start adding foods back in, but you always have to pay close attention because, again, some people will flare from certain foods while others won't.
Yeah, I don't love the word diet. I think of it more as an eating template where we're looking at concepts. So eating foods as whole and unprocessed as possible. Avoiding or drastically reducing your intake of foods that are going to raise blood sugar and insulin. Avoiding or minimizing foods that are going to have strong hormonal influences. So things like dairy that have growth factors in them and that change our sensitivity to androgen hormones, things like that. So I think Dr. Alison laid it out pretty clearly, but I also want to emphasize that we don't advocate being super strict forever. It can be helpful to be strict in the beginning to quickly get inflammation down. But you need some variety in your diet, especially when you want to cultivate a healthy and diverse gut microbiome, lots of types of vegetables and things, but also just because we know that people aren't going to be adherent to such a strict diet forever, and it's not meant for that. But the goal is to stabilize your body, allow your body time to heal, and then depending on you and where you are and how you can tolerate certain things, most people can add things back on occasion in small amounts, depending.
Right, and you mentioned there were different reactions depending on, like, nightshades, for example. Is there a food allergy test that could help HS patients find out if there are foods they do need to remove?
We do use food testing in our clinic. I think the important thing to know is that there's no such thing as a perfect food test, but we do look at tests that look at different ways the immune system can react. For example, we had mentioned the IgE, immunoglobulin E reactions earlier. Those are true allergies. It can also be helpful to look at immunoglobulin G. Those are delayed type reactions, or they're considered hypersensitivities. And then we also like to look at complement reactions, and complement can enhance other types of immune reactions, but we know that's part of the inflammatory cascade, also associated with autoimmune conditions. So we do testing, again, that looks at IgE reactions, IgG, and then complement. Having said that, it doesn't account for things like a lactase deficiency. That's the enzyme needed to process the dairy protein. So there's no perfect food test that is going to check for every possible way the immune system can react. But in general, we find that when we do the testing, patients avoid the foods that are causing the big inflammatory reactions. We do tend to see inflammation drop more quickly. And then again, the goal is to really get the gut healed up so that they can tolerate more food. So we're never keeping people on a restrictive diet long term. It's just used as a tool to drop inflammation, to support healing.
Yeah, and I'd also like to add that it's important to realize that food allergies and food sensitivities are really kind of a secondary effect or like a byproduct of a damaged intestinal barrier. So it's, you know, once you start getting that breakdown of the barrier and your intestinal cells are damaged, or if you've got really poor digestion, this is why it's important to avoid artificial food colors and flavors, because they interfere with your digestive enzymes' ability to break apart proteins into amino acids. And then when you get a bunch of whole undigested proteins getting into the gut and passing through the wall and getting into your bloodstream, your immune system's going to freak out because it's trained to recognize protein sequences. We should be getting individual amino acids. And so we need to make sure that we're supporting digestion. Unfortunately, a lot of people have taken proton pump inhibitors or acid blocking medications that suppress stomach acid. And so that can be a long-term, effect, and they're not breaking their food down. And so that sets us up for pathogens to overgrow and things of that. So in thinking about why a person has multiple food reactions, we need to take a step back and ask the question, why? What's causing this in the first place?
Right. And it seems like food, and which is then related to gut, has such a big impact on HS. So why do you think food or diet changes is so controversial in the HS community?
Yeah, and it is controversial. We get some heated comments on our videos that are related to food. I think there's so many reasons, Adrienne. I think number one, I think there's an element of shame and blame. So if we say these are the foods that you're eating that are causing, right? And we want to be clear, foods don't cause HS. It's one variable, but I think there's a tendency for people to take it personally if they have been consuming some of the foods that are recommended to be avoided. And it's also kind of jarring when the only things that you like to eat are the ones that you should probably avoid for the time. It's hard. Food has cultural meaning, and also I think there's no consistent recommendation for what everyone with HS should avoid, because there is no such thing. So someone might say you have to avoid nightshades, and another person might say I did that for 3 months and saw no results. So there's no consensus over what the right answer is. I don't know if you want to add anything, Alison.
I think there's so much more to it than just diet, and I know we're talking about the controversy of it. And again, I think it just goes back to individuality. What works for one person might not work for another. And here's the other thing too. It's about so much more than just diet. We've mentioned that already. For example, we'll have a patient that's doing everything right and not getting the result we would expect. That means there's something else going on. And in those cases, we might find that they have a mold exposure in their home, or they have some other infection that we didn't identify yet, or there's some other severe mental emotional stressor. Stress causes inflammation in the body too. So when somebody is doing quote unquote everything right and not getting the result, that means something else is going on that has to be identified.
That makes sense. Speaking of food, I know that you guys have written a cookbook specifically for autoimmune disorders. Can you tell us a little bit about that?
The hardest part for patients to change seems to be the diet piece. And so we really wanted to create a cookbook so they can still eat delicious food and still drop inflammation and get the results. And again, it's not a forever diet, but the cookbook is specifically a yeast-free autoimmune paleo guideline. And we worked with the chef in Boulder.
Yeah, and she was wonderful and put so much love into each recipe. But, this whole project came about because we've done some videos on YouTube about food and foods to avoid. And we were getting comment after comment after comment, like, are you crazy? There's nothing left to eat. What are we supposed to eat? And so just because of the sheer number of, requests and confused comments that we got, we wanted to show people that you actually have a lot of options. It just doesn't seem like it, at first glance. And so the cookbook was meant to take out the guesswork, but we also took a lot of time in the introduction to explain the science behind the diet and, tips for dining out if you need something while you're not able to cook at home. So it's really a comprehensive resource and not just a cookbook, but it was such a labor of love. It was a lot of work. But I know for me and also for Alison, when we were going through our own health journeys, one of the number one things that kept us going was having good meal ideas. And so I happen to be an avid cookbook collector. I own a lot of healthy cookbooks. And it's like you have to get really creative to make this doable and sustainable so that you feel like you can have something and it's not just boring rabbit food. So, yeah, we wanted to give people an easy way to say, here, you don't have to think about it now.
The rabbit food to live by.
Yes.
Well, thank you so much for talking with us today, Dr. Biscoe and Egeland. This has been an entertaining and enlightening experience, and we really enjoyed you sharing your expertise with our audience about HS.
Thank you so much, Adrienne.
Thanks for inviting us.
Yeah, it's our pleasure. And now for those of you in the audience who want to learn more or reach out directly to the Attune Functional Medicine Clinic, you can visit their website at attunemed.com and click on the contact section for contact information and clinic hours. Or you can email them directly at info@attunemed.com. And also for those who suspect that they have HS, and those that do, and even those that are affected by it. So let's say if you're a family member or friend of those who suffer from HS, there is a free comprehensive online resource available, which can be reached at helpforhs.com, and it is an excellent hub of information. And this includes a valuable resource newsletter tool. And you can also find us at TrialSite News on Instagram, Twitter, Facebook, and YouTube, and the links will be provided in the description below. Thanks again for joining us today, and we'll see you all next time.